Nasal polyp. Nasal polyp is non-neoplastic masses of edematous nasal or sinus mucosa. It have main two varieties. First is enteroconal, second is bilateral ethmoidal polyp. Enteroconal polyp, it arises from the mucosa of the maxillary antrum and grows in the choana and nasal cavity. It has three parts. First is antral, which is thin and stalk-like. Choanal, that is round and globular. Nasal, it is flat side to side. Etiology of the enteroconal polyp is exact cause is unknown. Nasal allergy coupled with the sinus infection is incriminated, seen in children and adults. Usually they are single or unilateral. Symptoms: unilateral and bilateral nasal obstruction. Voice become thin and dull due to hyponasality. Nasal discharge mostly mucoid. Sign: it grows posteriorly and it is large, smooth, grayish mass covered with the nasal discharge. On posterior rhinoscopy, may be revealed as a globular mass filling the choana or the nasopharynx. And here you see enteroconal polyp projecting through the left nostril in the 14-year-old patient. Here, second picture is enteroconal polyp seen in hanging the oropharynx from behind the soft palate and soft palate on the right side of uvula. And the second image is polyp after the removal. An endoscopic view of choanal polyp on the right side. Differential diagnosis of the enteroconal polyp is blub of mucus, hypertrophied middle turbinate, angiofibroma, neoplasm. Second variety, bilateral ethmoidal polyp. It may arise in the inflammatory conditions of nasal mucosa like rhinosinusitis and the disorders of ciliary motility or abnormal composition of nasal mucosa in cystic fibrosis. Various diseases associated with the formation of nasal polyp are chronic rhinosinusitis, asthma, aspirin intolerance, cystic fibrosis, allergic fungal sinusitis, and Karta-Guerin syndrome, Eng syndrome, and Kerg-Strauss syndrome, and nasal mastocytosis. Pathogenesis. Nasal mucosa, particularly in the region of middle meatus and terminate, become edematous due to the collection of the extracellular fluid causing polypoidal changes. Pathology. In early stage, nasal polyp covered by the ciliated columnar epithelium, but later metaplastic changes change transitional and squamous epithelium on exposure to atmospheric irradiation. Site: multiple nasal polyp always arise lateral wall, usually from the middle meatus. Common sites are uncinate process, Bulla ethmoidalis, ostia of sinus, middle surface, and edge of middle terminate. Allergic nasal polyp almost never arise from the septum or the floor of the nose. Here, a polyp protruding from the left nostril in a patient with the bilateral ethmoidal polyp. Site. On anterior endoscopy, the polyp appear as smooth, glistening, grape-like masses, often pale in color, multiple and bilateral. Symptoms: multiple polyp, nasal stiffness, loss of sense, headache, sneezing, and watery discharge, mass protruding from the nostril. Diagnosis based on clinical examination and CT scan of paranasal sinus is essential to exclude the bony erosion and expansion suggestive of neoplasm, and also CT scan helps to plan the surgery. Treatment: conservative treatment is antihistamine, control of allergy, or steroids may prove useful in case of people who cannot tolerate antihistamine or in those with asthma. Surgical: endoscopic sinus surgery. Ethmoidal polyp are removed by the endoscopic sinus surgery, more popularly called FES, functional endoscopic sinus surgery. Here are endoscopic view of multiple nasal polyp.